This is the literature review regarding dermoscopy monitoring versus visual inspection for early detection of melanoma in sun-exposed adults by Brooke Hazy, University of St. Augustine for Health Sciences, Family Nurse Practitioner Program. My clinical background is dermatology with over 17 years of experience. I started my nursing career as a CNA to LPN and then RN. I am currently in the MSN Family Nurse Practitioner Program, and I look forward to continuing my career in dermatology. This presentation demonstrates a proactive approach to surveillance of the skin, which can lead to early intervention and potentially life-saving treatment for patients at risk for developing melanoma. This is an overview of the skin. In the deepest layers of the epidermis, just above the dermis, resides melanocytes. These cells are responsible for skin pigment. Melanoma originates from these cells when abnormal growth forms. As these changes become more predominant on the surface of the epidermis, the lesion may be easier detected by the healthcare provider. Every hour, more than 2 people in the United States die due to skin cancers. This aligns with over 9,000 diagnosed cases daily. Skin cancers are classified into 2 main categories: non-melanoma skin cancers and melanoma. The National Cancer Institute recommends a skin exam for any adult with a history of sun exposure. Traditionally, skin exams are performed by visual inspection of the skin. A dermatoscopy is a magnification technique using visible light that allows a more detailed exam of the skin compared to the naked eye alone. This instrument provides a high-power 10 times magnification of the skin to visualize the structures of the epidermis and superficial dermis. The American Cancer Association estimates that over 200,000 melanoma cases will be diagnosed this year. This aligns with approximately over 8,000 related deaths. In the United States, skin cancers have an estimated cost of $8.1 billion, with over 40% of the cost related to melanoma directly. It is 1,000 to 2,000% more expensive to treat a more advanced melanoma than one diagnosed at an earlier stage. The intervention in this study involves adult individuals with a history of sun exposure and regular dermatoscope monitoring to detect melanoma in its earlier stages. As the healthcare provider incorporates this into patient practice, the more specific and sensitivity are increased in determining if the diagnosis of the lesion is a melanoma. This reduces the incidence of diagnostic excisions. Dermoscopic monitoring is currently considered to be the first line of monitoring for melanomas during a skin examination. The result of the search strategy yielded a total of 12 studies that met the inclusion criteria. These studies were identified through a comprehensive search of databases from their inception up to 2021, as well as a thorough of the review of resource list and published systematic review articles. The search string used focused on keywords related to melanoma, dermatoscopy, and dermoscopic monitoring. Studies meeting the inclusion criteria primarily involved long-term dermatoscope monitoring in the adult population with a history of sun exposure, while excluding studies related to non-melanoma skin cancers, individuals younger than 18 years or older, and articles that were not available in full text. Dermatoscopy aids in earlier detection compared to that of the standard visual inspection. Identified melanomas exhibited lower Breslow tumor thickness and predominantly melanoma in situ upon excision and diagnosis. Higher sensitivity in diagnosis was observed with minimal dermoscopy training. Examinations conducted by clinically experienced specialists in a clinical setting. Specific algorithm usage showed no significant impact on additional procedures. The ABCD criteria was often used during the visual inspection prior to dermatoscopy use. The comparison of digital images compiled from the dermatoscopy use was identified as an additional tool that aided in early diagnosis of the cutaneous melanomas. The digital images were reviewed during follow-up examinations and documented in the patient's electronic medical records. A notable difference between the quantitative and systematic reviews include the application of liquid on the skin prior to the use of the dermatoscopy. This allowed for the epidermis to become more transparent. In addition, one study included patients in a hospital setting with both inpatient and outpatient statuses. This slide presents the planned change involving the integration of dermoscopy as a standard practice in skin cancer screenings within our healthcare organization in a clinical setting. This initiative aims to improve the accuracy and efficiency of skincare diagnosis by providing healthcare professionals with advanced diagnostic tools and training in dermoscopy. By incorporating the dermoscopy into the routine skin exams, we will anticipate earlier detection of melanoma, leading to timely interventions, improved patient outcomes, and ultimately a reduction in morbidity and mortality associated with skin cancers. Through comprehensive training programs, implementation strategies, and ongoing evaluation, we aim to ensure successful adoption and sustained utilization of dermoscopy. Change is stressful enough even when people are well prepared for its demands. Action imposing on people who are not adequately prepared can be intolerable. The book written by Kotler and Cohen, Heart of Change, in 2012, identifies the 8 steps for change within an organization. Identifying the need for change is step 1, followed by the selection of a team as step 2, the implementation strategies in step 3. Step 4 is sharing the message with the vision. Step 5 includes ensuring that the right tools are in place to achieve success, allowing for small achievements is step 6. Ensuring that even though hurdles may happen, the plan is still implemented is step 7, leading to the final step of ensuring that behaviors are sustained. As the evaluation of this evidence-based practice problem is reviewed, the criteria listed on the slide below will help determine if the interventions were successful. They include a decrease of excisions and/or a lower Breslow's level. Did the patient have a positive outcome? And was there a reduction in healthcare cost? The collection of measures towards the outcome of utilizing a dermatoscopy to identify melanomas at an earlier stage includes a collection of patient data through electronic medical records. Key performance indicators can help to determine the clinical outcome of the evidence-based practice question. The key performance indicators are measurable indicators that determine the effectiveness of the goal. Processes to obtain clinical information will be limited to the access of individuals directly involved in the research. The federal guidelines for following include the Health Insurance Portability and Accountability Act, also known as HIPAA, of 1996. HIPAA is defined by the Centers for Disease and Control Prevention as a federal law that requires the creation of national standards to help protect sensitive patient health information from being disclosed without the patient's consent or knowledge. The t-test will be utilized to determine the significant differences between the means of the two groups. This will be utilized to identify if the outcomes occurred by chance or if it represents a real difference. This multi-level approach ensures the impact is significant. Starting on a local level includes community outreach to ensure the importance of routine skin examinations are communicated. as an institutional effort to ensure all members of the healthcare team have a solid knowledge base within the clinic. Ongoing continuous education can be implemented throughout the team. As data is revolving cycle, the continuance of the use of knowledge and information can be implemented into journal articles and during national conferences for educational purposes. This is an image of a dermoscopy. In conclusion, the comparative analysis aimed to assess the impact of dermoscopy-led examinations on early melanoma detection in the adult population. Findings indicate that this intervention not only reduces healthcare costs, but it enhances survival rates, lowers specialty referrals, and yields positive patient outcomes. This study provides valuable insight for healthcare providers, empowering them the knowledge to facilitate early melanoma detection and improve patient care. It is recommended that incorporating this into routine skin exams in an outpatient clinical setting. Thank you for being a part of this presentation, and any questions or concerns can be emailed to b.hazy@usa.edu.